I think we have a few minutes for questions from the audience. Please go to the microphone, introduce yourself, and ask the question. Perhaps I will start with a first question to Erika. Erika, what would you suggest, for instance, in a young patient who is concerned about the risk of loss of fertility for adjuvant chemotherapy? Would you recommend the concomitant use of LH, RH analogs concomitantly with chemotherapy, specifically assuming that the tumor is a ER-negative tumor, so there would not be any reason to give this type of treatment? Which would be your recommendation?
So as we reviewed, there have been, at least in the past 2 years, 2 prospective randomized trials published suggesting concurrent LHRH agonist for fertility preservation does not seem to be effective. And so that's not an approach that would provide much reassurance for a patient. However, for any patient who is even a small amount interested in fertility preservation, we would strongly recommend consultation with a reproductive endocrinologist or fertility specialist. We feel quite confident that the majority of patients can very safely undergo endocrine stimulation for embryo or oocyte banking if that's what they wish.
Thank you very much. I think there is one question there at microphone 1. Or I'm wrong. No, I'm wrong. He was leaving, actually. I do not see other questions, so I would like to ask a question to Dr. Sparano. No, there is a question there. Number 2. Go ahead, please.
Nettekoven from Switzerland, Neuchâtel. One question to Dr. Meyer. You showed the data concerning troponin in the cardiotoxicity. Are there any data known for measuring BNP? And the second question is, are there data who show evidence for giving ACE inhibitors or beta blockers in preventing cardiotoxicity?
So there has been analysis looking at BNP, brain natriuretic peptide, as a biomarker possibly predictive of cardiac toxicity. Unlike troponin, where there's been a stronger signal, the results for BNP have been very mixed, and right now there's not much data that would be helpful. I find the small study that I presented looking at the cardioprotective effect of ACE inhibitor very provocative, but it's quite small. There is an ongoing study now that has the wonderful name of PRADA that is looking at prospectively at providing ACE inhibitor and beta blocker to patients thought to be at risk for cardioprotection.
Thank you.
Okay, thank you very much. I think it's now time to close the session, and thank you very much for your attendance.